This podcast has been kindly supported by Oral B. If you want to learn anything about their products, check out the link in the description. Thank you, Oral B, for sponsoring the podcast. Okay, so welcome back to the Oral Health Podcasts. My name is Sophie. Karen's actually not with us today, but we are joined instead by Louis Mackenzie, who is here from Oral B and is going to talk about preventing oral disease. So, Louis, can you just introduce yourself? Sorry, I said both Louis and Louis. Which is it?
Well, pre-Brexit, I didn't mind either, but since Brexit, it's Lewis.
Louis, cool. No worries.
So thank you, Sophie. My name's Louis Mackenzie, and I've been a dentist for over 30 years. I'm a part-time university lecturer at the dental schools here in Birmingham, where I am today, and down in London. So I've been involved in dental education for about 20 years, and that's where my link with Oral B comes in. And most recently, for the last 3 years, I've been the head dental officer at Denplan.
Amazing stuff, yeah. So obviously we're talking about preventing oral disease, but the term oral disease could mean anything. So just in case people aren't familiar with that, can you just explain that term in a little bit more detail, what oral diseases are?
Yes, certainly. Well, there are a number of different oral diseases, and the three main ones, though, and the first of those is tooth decay, which I think everybody is familiar with. So that's the most common one. Gum disease is the next most common, and then tooth wear. That's one of the fastest growing oral diseases. And this is caused when people drink too many acidic drinks and foods. It actually erodes the enamel on their teeth. And then, of course, there are a lot more sort of rarer diseases which can affect the soft tissues in the mouth and indeed on the lips. And of course, the most dangerous of these is mouth cancer, which is a really, really nasty condition. And unfortunately, the incidence of that is growing. It's now the 15th most common cancer in the whole of the UK. And together, all of these oral diseases, they're actually the most common, what are called non-communicable diseases on the whole planet. And by that I mean these diseases are the most common after contagious diseases like coughs and colds and of course our recent menace, COVID-19.
I like that. I've not heard COVID described as a menace, but I feel that that's quite accurate.
It's
But so when you say common, how common exactly are they? So I think there's some crazy statistics about tooth decay in children, which we see a lot in the news. But yeah, how common are oral diseases?
Well, they're massively common. Tooth decay, which I mentioned, is actually the most common human disease on the planet. The latest statistics suggest that currently there are 2.5 billion adults around the world suffering with tooth decay. And what's even more upsetting is that 600 million children have got decayed teeth around the world as well. In the UK, it's around about 27% of adults have tooth decay currently as we speak, and about 8% of children. And then gum disease, as I mentioned, that's the next most common. But even that is the sixth most common human disease. And of course, it's the most common cause of tooth loss as well. And erosive tooth wear, which I mentioned, is rising massively. And this is particularly due to people drinking more acidic drinks, and especially in children as well. So the tooth wear rates for children are really quite worrying. So unfortunately, it's not great news, and essentially because all of these diseases are entirely preventable.
Well, are they because they're happening to so many people like you say, the most common disease is tooth decay, and then that gum disease is not that far afterwards. How realistically preventable are they if they're happening that much?
Well, that's that's the really sad thing. They are 100% preventable. There's absolutely no reason for any adult or any child to ever get tooth decay, gum disease, or tooth wear at any point in their lives. And even mouth cancer is considered in the textbooks to actually be a lifestyle related disease. because it's mainly occurs in people who smoke, unfortunately.
Hmm.
Another problem with oral diseases is that you can't treat them with medicines. They actually need active treatment by a dentist or a hygienist or a dental therapist. So to be honest, there's never been a better case for that old saying that prevention is most definitely better than cure in every respect.
So then how can people that are listening or want to be a bit more vigilant with their oral health, how can they, especially if they've got children, make sure that they don't encounter any of these oral health problems down the road?
Well, as a dentist, obviously, I would say the first thing is regular trips to the dentist. Very important, just to make sure things are okay. But of course, as we've seen in the news, even that's a challenge at the
Yeah.
moment because there's a real shortage of dentists in the UK. You know, obviously the population is about 70 million, but we actually have the lowest number of dentists to serve that population than any European country. But really, the most important thing for your listeners is what they do at home to look after their own teeth and their children's teeth is the number one most important thing.
Mhm. Absolutely. And I agree with you completely. The advice obviously we always give is go and see a dentist, but we have to also be conscious that's not possible a lot of the time at the moment, and people are having to wait a long time. But that will always be golden rule. Is go and see a dentist as far as we're concerned. But what should people do themselves if when they can't get to the dentist then?
Well, that's quite an easy one. And even if you are going to see the dentist
Oh yeah, do
regularly,
these things anyway.
do
But
these things every day anyway. And of course, these things will be familiar to your listeners. You know, brush your teeth and have a healthy diet. But actually, it's quite detailed, and the reasons for doing these things are well documented. So if we look at those two main things and sort of maybe start off with diet. Well, in the latest statistics show that the average person in the UK eats 39 kilograms of sugar per year, which is an almost unimaginably large amount, and it's really too much because too much sugar can have a range of negative effects on your body. And of course, it's tricky because sugar is in foods and drinks in lots of different forms, and it can be really hard to spot. There's some recent publications showing that even some baby foods, which advertise as being healthy, have loads of sugar in them. So it is really tricky. Now, this sugar, when it gets into the mouth, it doesn't directly damage the teeth and gums, but unfortunately it's the bacteria that live in the plaque that's sitting on the teeth that do the damage. And we've all got plaque on our teeth. Nobody can escape that. And so it's these bacteria that cause the problems, but because they convert the sugar into acids, and it's the acids that do the damage to the enamel. Now, enamel is it's actually the hardest substance in the body. It's as hard as steel, but which is amazing to believe. But it's got this real Achilles heel that enamel is soluble in acid over a period of time. And so if it continues and you get cavities, which are literally just holes in the enamel, when they form, they're actually irreversible. You can't fix those yourself with brushing and toothpaste. And so once formed, a cavity can only really be fixed by a dentist. And then at the same time, while this is happening to the teeth, the same acids can cause inflammation of the gums around the teeth. This is known as gingivitis, which literally just means inflammation of the gums. And again, if that goes on for long enough, the acids can cause damage. But more importantly, the body actually overreacts to this in trying to defend itself. And it's actually a self-destructive immune reaction, which causes 80% of the damage. And if it continues, it can destroy the bone around the teeth progressively. And if it progresses, the teeth can become wobbly or even fall out, or become so uncomfortable that when you're trying to eat, it just becomes too uncomfortable, and they actually have to be removed by a dentist. Another problem for us is that, unfortunately, these disease processes, although they're really very, very slow, they can take years to progress. Tooth decay and gum disease are often completely painless until they're really at quite an advanced stage. And by this time, it can be much more difficult for your dentist or your hygienist or your dental therapist to actually fix the problems.
Yeah, I can imagine because yeah, we've spoke about this a little bit before a while ago, where the decay needs to get all the way to the nerves essentially for it to be causing pain, or because it's just such a deep hole. Is that my rudimentary understanding? Is that right? Or
Absolutely right. The decay, the enamel's the tough bit, the tough outer surface of the tooth. It can take literally years for the decay to get through that. It can proceed at a faster rate if somebody's not brushing very well and has got a very high sugar diet. But once it gets through the enamel layer, and the enamel is up to about almost a millimetre thick in places. Once it gets through the enamel, it gets to the dentine layer. Now, this is much softer, and so once it gets to the dentine layer, it can move more quickly. It can still take months and years, and then it can progressively sort of get deeper and deeper. And then this is when it starts to affect the nerve inside the tooth, and so that's when you start to feel some sensitivity to often to cold things, to hot things, and then that discomfort can get worse. And if it gets even worse, then the infection can actually get as far as the center of the tooth, the pulp of the tooth, which is where the nerves and the blood vessels are, and it can actually kill the tooth completely.
yeah.
Then that can lead to an abscess, and anyone who's had an abscess or knows anyone who's had an abscess
How
will know
awful they are when you've got
they
one.
are so uncomfortable, and then that needs a more sort of specialized way of
Treating
treating.
it. Yeah.
Yeah.
Well, just listening to that, it just hammers home as well how important it is to prevent it. And if diet then is the big thing that you can do to prevent it, what's the second most important thing to prevent oral disease?
Well, that's good old toothbrushing with a fluoride toothpaste. Now, there's total agreement. Every dentist around the world, every scientist will tell you that the best time to brush your teeth is to do one brush last thing at night, and then not to eat anything or drink anything after that, other than any water if you need to.
Hmm.
But then to brush a second time the next morning, and that's because bacteria have literally been just sitting on the teeth overnight and multiplying during the night. Sounds horrible, doesn't it? And also another problem is when we're asleep, our saliva flow actually drops massively. During a day, we produce about 1.5 liters of saliva, which we swallow. Which wouldn't want to do it all in one go. But most of that is when we're awake. When we're asleep, the saliva flow drops dramatically, and of course, saliva is naturally protective of teeth because it actually neutralizes acids. That's one of its main functions, as well as sort of lubricating the mouth. So when you're asleep, this protection is dramatically reduced. So it actually makes it more vulnerable. So therefore, you should brush again in the morning. Now, nobody knows whether it should be before breakfast or after breakfast. There are lots of different studies on this. I personally always recommend actually brushing after breakfast, because, as you know, if you have bits and pieces, getting caught in your teeth, if you brush your teeth first, have your breakfast, and you get bits and pieces stuck between the teeth, they can stay there literally all day long if you don't brush after. So I always recommend brushing after breakfast to my patients. The next bit of advice is, I would say, if you can, use an electric toothbrush, ideally with a small round head that rotates and oscillates at the same time. Because plaque itself is actually quite sticky. It's not actually that easy to remove. And the nice thing is with the electric brush, you don't have to scrub too hard. You just get the brush in the right place, brush every tooth, and literally the bristles just do the work for you.
Mm-hmm.
My current favourite recommendation is the IO powered toothbrush from Oral B. I absolutely love it.
Yeah.
The next tip is the old classic brush for 2 minutes, because 2 minutes, studies have been done to show that after 2 minutes, you've removed the vast majority of the plaque and therefore the bacteria. You can never, ever get your mouth 100% bacteria free. It's physically impossible. But unfortunately, again, further studies show that the average person only actually brushes their teeth for 46 seconds. That's another reason that I love the IO, because it's actually got a timer. It beeps at 2 minutes, and the toothbrush even smiles at you when you.
It does. I'm allowed to say this because we're sponsored by Oral B today. I have an IO, and it tells you off when you haven't brushed for 2 minutes. It pulls like a proper angry face at you. It's really like, oh, I've upset my toothbrush. I need to keep going.
Right.
It keeps you on top of it. It's funny.
It's good cop and bad cop in the
Yeah.
same technology, and also it's got that light which you'll be familiar with that tells you when you're brushing too hard or actually not putting enough pressure on. So yeah, it's really clever. Other things that I recommend is brush in front of the mirror so you can see that you're brushing all of your teeth evenly. It's really, really easy to overbrush certain areas depending on whether you're right-handed or left-handed, and sometimes to actually completely miss other teeth that you think you've brushed, but you might not have. And then, of course, the next thing is toothpaste. My personal recommendation is one with stannous fluoride, my favourite being Pro Expert. And the fluoride in toothpaste works the same way that it does in fluoridated water, like in Birmingham, where I live. Fluoride is really clever. It works in three ways. One, it strengthens the enamel, actually makes your teeth more resistant to the acids. It actually helps repair the damage if teeth before the cavities form. It can actually repair the teeth. And then finally, it actually affects the bacteria themselves. It actually reduces their ability to produce acids. It messes up with their enzymes, so they don't like that. And also recommend, particularly a patient's got gum disease, actually using little brushes in between the teeth to get to those really tricky little bits which normal brushing can't access. And then for children, I'm really adamant about this. To parents, I always say, don't just supervise the brushing, actually do it for them. Clean their teeth for them until the children are old enough to do it properly. And with some children, that's pretty much going to be until they leave home. But because children just don't understand the importance of brushing. Their mouths are small. They've got less dexterity, and of course they can't see what they're doing as well. So parents brushing children for them, and again making sure that every single tooth that is brushed. That, for me, that's probably one of the most important messages on our podcast. And then finally, from an environmental point of view, don't leave the tap running while you're brushing. Don't even switch it on, because this wastes loads of water, and you don't need to rinse out after brushing. All you need to do is just spit out any excess toothpaste, and then by not rinsing, the fluoride literally hangs around for hours, continuing to do its wonders.
It is an incredible thing, fluoride, and we've spoken before about fluoride for a different Smile Month podcast a couple of years back, which I'll link in the bottom of this one if you want to listen to us talk about that in more detail. Because that was a really great detailed description of how to look after teeth and gums, and it's good to hear. Do you think there's going to be a time in the future where we don't even need to discuss this? We'll have prevented it completely from even happening.
Well, so I always try to be positive, but I have to say, for some parts in the world, I'd have to say no. I don't think that will ever happen. For example, sort of in developing countries where they can't even get enough fresh water, and they certainly don't have access to any dental care at all. And then regarding diets, I mean, it's so upsetting that even in this day and age, as the stats show, 1 in 9 humans around the world, as we sit here chatting today, are suffering the effects of hunger and starvation. So, but in the UK, I think we have got more reason to be positive, although we have got the lowest percentage of dentists in any European country. Britain's population actually has among the best oral health in the whole of Europe, and we've got significantly better health and less inequality than people living in the United States. So any of that sort of Austin Powers British bad teeth myth, that's is a complete myth. So yes, I am hopeful for the future. The UK dental profession will continue to do what it does all the time. It's designed to do, continuing to strive to help Britain's oral health be literally the best in the world. But as I've mentioned, several times in our chat today, the most important thing for your listeners is how well they look after their teeth at home and the teeth of their families as well. There is absolutely no reason for a child being born today to ever need any dental treatment in the whole of their lives, because as we've discussed, these diseases are 100% preventable, and that's why so delighted to be asked to come and chat on the Oral Health Foundation's Smile Month. You do an amazing job in raising this awareness of the importance of oral health, and so I just really like to sort of finish by just say a massive thank you to Sophie, to you and your team at the Oral Health Foundation for the wonderful work that you do, and to Oral B and all the other oral health care companies for developing these technologies that help us look after our teeth and gums. And of course, a massive thank you to your listeners for taking some time up today to listen and hopefully to think a bit about the oral health of themselves and indeed their families and other people as well.
Yeah, I don't think I could have rounded that up better myself. Yeah, thank you, Louis, for spending time with me. Thank you, Oral B, for sponsoring this podcast and allowing us to actually sit and talk to Louis. Then, yeah, thank you again for listening. We'll be back in a couple of days talking about oral disease in a little bit more detail with a few other guests that we've got. So come back and have a listen then.